assaulting injury, severe pain will be there. That severe pain is due to hyperemia and maybe due to inflammatory changes just afterwards of just as the aftermath of that severe injury. Such a condition should be managed with medicines like Morgana. In the acute phases, Kshadoshma will be there, which gradually migrates into Vadarekta later onwards. And in such conditions, Morgana will not work. In such conditions, management of Vadarekta should be done. If management of Vadarekta is done at the initial instance, you will be landing up yourself in trouble. The pain will only be exaggerated. In such conditions, Morgana has to be used. That is why where the traumatological importance and the period of treatment, the avastha of the treatment has also to be chalked out. Seasonal importance of cervical spondylosis. In hot season, Vata will aggravate by lepthavavashatva. Because as is mentioned by Vadbada in the 3rd chapter of Sutrasthana, Tichnamshur Aditishnamshur Grishme Samkshipati Vayal Pratyaham Kshiyadeshleshma Tena Vayushcha Vardade. Vata will be in a state of Chaya in Grishma Ratu. So that the Vata is to be managed as the Vata is in Labdhavavasha stage. The same Vata is to be managed in cold season by another means, because Vata will aggravate by Ruddhavakasha. So both these are different, even though both are Vata by itself. The pathology of the structure precedes functional compromise. Function structure are to be seen differentially. In cervical spondylosis, it's the loss of the structural integrity which precedes the loss of function or pain. There is no doubt about it. There comes a structural problem, then only functional problems will be there. It's not the functional problem which precedes structural problem. It is all, there will always be a lesion there. There will always be a structural problem there, which alone is followed by the functional incompetence. By the time the symptoms dominate, much of the structural damage would have taken place. Like for example, the status of the muscles, status of the bones which go into a state of spur formation, etc. will dominate. Thereafter, still continuing, thereafter the structural events will be snowballing and will be reaching to such a state where much of the treatment will not be possible. And coming to the difficulty in management, Roga Marga. Shirohadevasthyadi marmanya astinantu sandhaya tandibatha sira snayu kandarabhyascha madhyamaha. Sira snayu kandara. Shirohadevasthyadi marmanya astinantu sandhaya. So in this context, I think in the context of cervical spondylosis, this mention is very important. Shirohadevasthyadi marmani astinantu sandhaya. The sandhi of the bones, sira, snayu, kandara, etc. All this. Okay, thank you. But I have been given time till 12:15.
Yeah, including questions.
Including questions, okay. So I have been asked to wind up within 5 minutes. Management priorities and objectives. Whether we should manage pain or whether we should manage the disease. This is more important, and it all depends upon the cause of the pain, whether inflammatory or due to the pressure effect. The better objective, I think, is to manage pain first of all, then stiffness, then increase the range of movement, and then manage the degeneration potential. I am not going into the scientific aspect which is mentioned by Sushruta as per Shatkriya Kala or by Vagbhada in Nidana Dosha Dusha Samorthana, etc. And I am not also going into the symptom-oriented conditions like Pabakuga, Griva, Graha, Manyastambha, etc. because I have already told you that cervical spondylosis, the name itself is more important than the conditions which is enlisted centuries ago in Ayurveda. It can also be correlated by with Rekta Pitta, Vata Rekta, etc. The first option is to give drugs to minimize the Shobha and Ruja, and the final lack of management consists of drugs for the management of Snayu and Astivikadas. The management of Avastha is more important than anything else, whether Amavastha is there or not. Then only we have to do Bilya Chikitsa, then Astikshaya should be managed. Astikshaya, in management of Astikshaya revolves around the management with Ksheda Ghrude, Stikta Samyudaya, Vastipistada. And in this perspective, we have to take into consideration the medas which is outside the bone, and the fat which is inside the bone, which we call majja. Role of nasya need not be overemphasized, but at the same time, if you do nasya karma in the ama stage, it will only create problems. Many are the people who are doing nasya karma at the time of amavastha, which produces complications. Hence, if no srodharotha is there, then only nasya karma is indicated. And scalp oil, many of us Kerala people do application of thaila on the head, which is a double-edged sword. In amavastha, it will create a lot of problems, whereas after that stage, it will give the patient significant relief also. The relief in the usual, it's almost over. Panel discussion is there because.
So questions come.
Okay, thank you. My slides are almost over. I think that after that, when the panel discussion comes, we can have further details. Okay. It is learned that the next speaker has to go by 1 o'clock train. Maybe that also may be the factor. Okay. The usual scenario of relief. After management of cervical spondylosis, I am drawing the general picture after management. 60% fair relief. Much of the problems are relieved, but yet certain stiffness is still remaining. That's the usual scenario. And 30% after a period of management for some 3 months or 4 months, they will also be getting good relief. And 10% of cases, no relief at all, even after any sort of management which we are doing. For cervical spondylosis, I am telling. To conclude, I am telling, any disease, including cervical spondylosis, is shaped by the specific configuration of the derangement of dosha, dhatu and mala. Any disease, dosha, dhatu and mala. As rightly pointed out by Vakara in Nidana, Dushya, Dosha, Dushya, Samorchana. The particular pattern maps the disease proper, and the successful management is the disintegration of this mapping, the breaking up of the Nidana, Dushya, Dosha, etc. With that, I conclude my speech on cervical spondylosis Ayurvedic perspective. The next speaker may be invited. Thank you.
In the last presentation, I gave an almost detailed account till Roga Marga. Shirohridevastyadi marmanyastinantu sandhaya tannibaddha sirasnayu kandaradhyascha madhyama roga marga siddha tatra yakshma pakshavadha ardida murthadiroga sandhyasti trigashula grahadeyaha. This is important in this context of cervical spondylosis, in the sense that diseases which accounts to Bahyarogaina are comparatively amenable to treatments, because we can do Snehasweda and bring the waste to the koshta and then eliminate as per the nearby srotas, either through the oral cavity or by through the rectum. But when coming to the Madhyama Roga Marga, management is comparatively difficult. Even in Abhyantara Roga Marga, Koshta Rogas are comparatively amenable to treatment, very comparatively easily. Snehasweda can be done. But with regards to the Madhyama Roga Marga, it is very difficult to manage. This cervical spondylosis occupies such a place that it is very difficult to remove the Ulklishta dosha from there. Nasya is the therapeutic strategy which is described, the Panchakarma which is described. But then Nasya is said to be done in Urtha Jatra Vigaras, not Jatra Vigaras, Urtha Jatra Vigaras. Nasahi Shirsodwaram, Tena Tad Vyapya Handi Tantan Vigaran. But this is not Shiras. Cervical spondylosis does not occur in Shiras. And at the same time, it does not occur in the thoracic region also. So that Vamana is also not the exact therapeutic strategy which works there. So Acharya have indicated Nasya in the concept that Nasya is the only one therapeutic strategy which can be made, Panchakarma strategy which can be made use of in such a condition. But it is not the exact procedure. So to all the reservations agreed, I think that Nasya can be done with not much benefits. But Nasya is the only therapeutic strategy which can be done. hence it is mentioned. This occurs in all Madhyama Roga Marga conditions. Shiras, Hridayam, Vasti, Hridaroga, we know, bulk of the Hridarogas are very difficult to manage. Whatever system of treatment you go for. Vastya, the Marma, Vasti means it's not bladder itself, it is KUB, kidney, ureter and bladder. We know that all these are trimarmas. Shiras, Hridayam and Vasti are trimarmas according to Charaka. This marmasthanas, when any condition comes, any pathological condition comes, it is very difficult to manage. Likewise itself is astinamtu sandhayaha. Even though in many marmas, according to the Vagbhara school of thought or Sushruta school of thought, are sandhi marmas itself. Of course, Sira marmas and other marmas are there. But coming to the point, I will tell you that this is to be considered as a marmasthana. Since Dr. Suresh, who was authorized to speak on marma, has not arrived, and I belong to the Sushruta school of thought, I am just giving a glimpse to the marma aspect also. It is very difficult to manage. So, Madhyama Roga Margas, whether it be Shiras, Hridayam or Vasti or even Sandhi, are comparatively difficult to manage. Tannibadha, Sirasanayu, Kandaradhyascha Madhyama. All these are explicitly related with cervical spondylosis. Sira, Snayu, Kandara, Marmani, Astinamto Sandheha, all these things. So it is comparatively difficult to manage. Tatra Yashma Pakshavadha Ardida, Morthadiroga, Santyasti, Trigashula Grahadeha. Trigashula Graha, when describing Roga Marga, why he should go for Trigashula, etc., simple conditions? Because these conditions are very difficult to manage. Low back pain, cervical spondylosis, things like that are relatively difficult to manage. Then coming to the management priorities and objectives. Many a patient comes to us with pain. Cervical pain, as we have already, most of the speakers have already recognized the fact that cervical spondylosis is characterized by recurrent bouts of pain and a long interval of painlessness. That means he is asymptomatic. If that patient is asymptomatic, whether he should be managed or not, or rather, if a patient comes to us with pain, what should be the prioritization which we have to give to the management protocol, whether management of pain or management of the condition per se, that means degeneration per se. The patient is often happy when the inflammatory signs are controlled. That's why many patients are not coming to us at the first instance. When there is pain, they go to allopathic doctor, rheumatologist, or they go to orthopedician, or they go to neurologist, and after taking their medicines for a while, the patients will get, there is no doubt the patient will be getting relief. But there will come a stage when the patient is no longer getting relief in a continuous format. Thereafter the patient is coming to us. So the patient is happy and contented when the inflammatory signs are controlled, when the pain is controlled, when the swelling is controlled, when the ROM is increased, the patients are comparatively happy. So our primary objective is to cure the pain. Thereafter, let us cure the degenerative condition. It all depends upon the cause of the pain, whether the pain is due to inflammatory or whether the pain is due to pressure effect upon the nerve. The better objective, what I consider, is to manage the pain frontally, then stiffness, then increase the range of movement, and then manage the degenerative aspect if need be. Kshatriyagala was projected by Sushruta, we all know. Kshatriyagala is projected only by Sushruta. He defines a therapeutic strategy whereby the pathology is enlisted here, only the pathology is enlisted here. Sanjayam, Pragopam, Prasaram, Sthana Samsharayam, Vyakti and Bhedam. Bhedam is a stage when it is very difficult to manage. Or the management is not successful, but at the same time you may control the patient as a Yapya individual. But then I will have to ask you when the patient is to be treated. The patient is to be Tatra Prathama Kriyagalaha Sanjayam. How do we know about Sanjayam? How do we know that in my case, for example, whether I have got a dosha Sanjaya? How can I know? How can I know when there is Prakopa? Because the premonitory symptoms of a disease will manifest itself only in Chaturtha Kriyagala, the fourth Kriyagala. That is the Kriyagala of Sthana Samshraya. Only in the Sthana Samshraya stage, Purvarupas will be there. If even Purvarupas are not there, how can you diagnose the condition? How can you know whether the patient is having Sanchaya or Prakopa or Prasara? It all depends upon the nature of work we do, etc. Suppose I am doing a particular nature of work which is reflective upon so many complications like not only cervical spondylosis, etc., etc. I have to naturally shelf those habits. I have to repair myself. I have to change my way of life. A diabetic, when he is known to be diabetic, we are asking him to abstain from a certain food which causes increase of blood glucose level. A patient who is having dyslipidemia, we are asking him to abstain from fatty food. But if the patient is not knowing, if the patient is not symptomatic, how can we know whether the patient is having dosha sanchaya or not? It is very difficult. So the management time we are getting is from Sthana Samshraya stage only. But then it is very easy for the patient, for the disease to progress into Bheda stage. Sthana Samshrayam, then Vyakti and Bhedam. There are only 3 stages, before which we don't know whether the patient is suffering from a condition. That is a Sushruta school of thought. Whereas Vagbhada school of thought is comparatively, relatively clear. Sarvabhavanam bhavabhavo nandarena yogadi yogadi vyavased sarvesham punarvigaranam nidana dosha dushya visheshebhyo bhavabhava visheshat bhavanti. This is very important. Due to a 5-minute exposure to AC climate, we are not getting cervical spondylosis. But continuous use of nidana, continuous indulgence in nidana may provoke the doshas, and simply because of dosha kopa itself, the disease will not occur. Dushya visheshebhyo bhava bhava visheshaha. The striking differential between nidana, dosha, dushya, visheshaha. All these things are contributing to the disease, and if nidana is there, but we are not allowing the dosha to be vitiated, there is no disease. Nidana is there, dosha is vitiated, but we are not allowing the doshas to vitiate, disease is not there. The intensity of contact between nidana, dosha and dushya is a primordial factor in the genesis of a disease according to Vagbhada Senior. Nidana dosha yada hyedetrayo nidanadi dosha nidanadi visheshaha na anyonyam anubandhanandi ishadva anubandhanandi abalava na tada abhinivartande vyadhayaha chiradvyava abhinivartande tanuvorva bhavanti asambhurna sarvalingorva. We, especially those who are after 45 years, are getting slight neck pain or slight back pain. That is usual. But the more we are indulging in the nidanas again and again, the more chances are there that the nidanas will vitiate the doshas, and then the vitiated doshas will accumulate and then invade upon the dushas, that is dhadus or malas. So the cutting up the bondage between nidana, dosha, between dosha and dushya is a management protocol which has to be adopted. Then this slide I have, the gist of this slide was previously explained. Symptom-oriented conditions like ababahuga, grivagraha, manyastambha, kasa, jwara also are a symptom-oriented condition where the whole course of the illness cannot be discerned by the name. What exactly do you mean by ababahuga? I am frequently asking this question to my students. How can you diagnose on the basis of the symptom-oriented condition? Jwara is there. What do you mean by jwara? Jwara occurs in so many clinical conditions. So in how can you, is treatment of that particular condition itself is necessary? See, our treatment is holistic in nature. We all tell that our treatment is holistic in nature. Irrespective of the various ramifications of the disease, whether it be tuberculosis, whether it be due to some other conditions like typhoid fever, etc., etc. So many we all know that jwara occurs in so many conditions. Jwara is just a symptomatology, but let it be a symptomatology. Even then, we can manage it on the lines of amavastha, because jwara is primarily caused by amavastha, whether it be due to tuberculosis or whether it be due to some other condition. If that amavastha is removed, then I was speaking to Dr. Sreekumar over there. Suppose somebody from some 3 or 4 persons from a family has come to me for treatment. Together they have come and they are sitting before me. One person may be affected with rheumatoid arthritis, another may be having cervical spondylosis, another may be having osteoarthrosis of the knee. What medicine would I prescribe for these three? Well, separate diseases. To the patient, all these diseases are separate and separate. One is having neck pain, one is having cervical spondylosis, so and so. Usually the first medicine which I write will be Rasana Saptam Kashayam. To the second individual also, Rasana Saptam Kashayam. To the third individual also, the same medicine. Is this doctor having no other medicines to provide for me? That will be the patient's thoughts. But to the sincerely speaking, I consider all this in a particular scenario where Amatha will be there. Let that Amatha go. Allopathic doctor may ask you, is this not our treatment? I am giving anti-inflammatory drugs to the rheumatoid arthritis patient, to the osteoarthritis patient, to the one who is having cervical spondylosis, because NSAIDs, as we all know, helps to reduce the pain and swelling and inflammation. Is this not allopathic treatment what you are doing? Giving the same medicine by the same principle to various types of conditions. I don't know how to answer if you are asking me such a question, or rather I am taking a bail out of it, because this is the difference between persons who are trained in the structural aspect of Ayurveda and the functional aspect of Ayurveda. I am basically trained in the structural aspect of Ayurveda. So I consider, in a holistic perspective, I consider all the diseases, all such different conditions as almost one and the same. I consider it as ama. My language is amatva. Allopathic person may have the language of inflammation. That is different. Only that much difference is there, I am telling you. It is in tune with the Vagbhara school of thought also, I think. The pathology, it is not Raktapitta, it is Vadarakta itself. That is another thing. The cervical spondylosis is not a symptom-oriented disease by its name, but by presentation. Because patients will be having different symptoms. In particular cases, cervical spondylosis also itself, one time he may be having pain, another time he may be having tingling or numbness or burning sensation or dragging pain, things like that. So it is not a symptom-oriented disease. By its name, it is to be envisaged by presentation. And taking our diseases, I am just giving an example of Apabahuga. Apabahuga is a composite term which may denote many pathological entities. It may have the inflammatory symptomatology, degenerative symptomatology, traumatic, neoplastic, tuberculous, idiopathic, psychological, postural, seasonal, etc., etc., etc. The list can be extended. The one thing I will tell you, it is so. Why I am telling all these things is because it is not the name that counts. Whether it is Apabahuga, the same patient may be having stiffness of the neck. Then we tell that you are having Greva Graha. If the patient is having tightness over here, we will tell that Manya Samha is there. If the pain is radiating down, we will tell that Vishwaji is there. Is it not the varying manifestations of the same pathological process? I am asking you. And hence, is not management the one and the same to be given to all these different conditions, whether it is Apabahuga, Greva Sambha, Manya Sambha, etc.? Coming to that point, I will tell you that we have got the first option treatment to minimize the Shobha and Rujya, that is inflammation. The final lap of management rests upon drugs for the management of, it is not the final lap of management, it is the mid lap of management, the drugs for the management of Snayu and Astivikaras, and thereafter degenerative conditions by various therapies and physical means. Therapies are not to be done in the first instance itself. You can give medicines internally, you can check out therapies later if it is not working upon the drugs. Then prevention of further complications. The first speaker, Dr. Ramesh, has told today morning that advices to the patient, that is never to use pillows, etc., or that advice should not be given. I am also supporting that view. Basically, I find that many patients who are denied pillows by orthopedicians, etc., gets good relief by using pillows alone. If they are using pillows to a standard size, that he is very correct. Means many see, I'm not of the such a type that I sleep like this. I usually sleep like this. in my side, lateral aspect, especially in the left side. So what happens if I am not using the pillows? When I am just telling that I am sleeping like this, then also my hands come like this, because I have to support my head while lying down. Otherwise what happens? Otherwise my neck will be laterally, it will be flexed more than what is necessary, and that itself will create problems. So usage of the pillows should never be completely avoided. It should be done. Your pillow should be given to the patient. At least a gauze roll should be given. A towel should be given, rolled, for the patient to lie down. Otherwise it may make complications. Prevention of further complications. Again, coming to the management aspect, I will tell you that more than the disease, the avastha is important. Whether the patient is in amavastha, that is the inflammatory element, we call it amavastha, or paga, according to Suchrada or Vagbhada, paga also. If so, or even that amavastha is not there, manage initially with Mahara therapy, then only do the Bilya therapy. Otherwise it may not work at all. Especially in Kerala parlance, I am telling you, it will not work. If you do the Bilya therapy first of all, then only Asthikshaya should be managed. So the management of amavastha, then giving Bala to the patient, then Asthikshaya management, this should be done in order. Asthikshaya. Very many persons are using Tikta Samyukta Gradas, means Gugluyukta Grada, Mahayukta Grada, etc. The strategy is this: Staulya Karshya Upajarena Medojan Asti Samshayat Jadan Kshera Grades Tikta Samyuder Vastibhistatha. The dictum is this, but never use this dictum in the first instance. This is the secondary or tertiary management pattern given. Why Tikta Samyuktair Vastibhistatha or Kshera Grades Tikta Samyuktai? Medas or fat, let us call fat. Fat, when it is before the bone or outside the bone, can be called as medas. Then bone comes, then majja comes, which is there inside. So medas, outside, then bone, then comes majja. All these things are fat itself. Medas is fat and majja is also fat. Rasasring mamsa, medas, then asti, then majja. Shukrani dadavaha. So that order is also correct. The role of Tiktakasādhita Grada and Kshera, that is how you manage degeneration. This is not how you manage inflammation. This is how you manage degeneration. Medas plus Vayu, because Medas is soft, but when it conjoins with Vayu, it curiously forms Kharatva. This Kharatva plus Shoshana is what is Asti is. Tiktarasa is Shoshana. Tiktarasa, when that is why if you use Gugluyukta Grada, Gugluyukta Kashaya, or plain Tiktaka Kvata or Mahadikta Kvata alone, it will not give, not only that it will not give any results, it will further complicate the matters, because it has got Shoshana. It has also to a certain extent got Stambhana property. Like Kashaya Rasa, it has got a slight Stambhana property also. So at the same time, this Shoshana plus, in addition, if you are giving Grada plus Kshera, that is Medas. Grada, both Grada and Kshera has got Medas. It gives on-site delivery of the apt medicines to the bone itself. I will call it door delivery. Door delivery of the medicines to the site of the disease itself. That is the benefit of using Tikta Grada or Gugluyukta Grada, etc. That may also be the benefit which you are getting while using drugs such as we have been talking about Prasaranyadi Kvata. Yakshirabhujo Jayanti Marudvigarana Bhagapunscha. So it should be taken, or at that time the patient should be on a fat-rich diet. Then only it may work properly. Or rather, fat may be the substance which helps to absorb these medicines and to help the delivery. Fat may be a mediator. Panchakta Gugluyukta has got Tridosha Shamana effect while taking into the rasas like Tikta, Madhura, etc. and the properties like Snigdha, Kadu, etc. into consideration. Classical therapies, so-called classical therapies, so Behi Parimarjana, Swabhava therapy, use of labas, etc. Then Sneha Sweda, when Sneha is to be given and when Sweda is to be administered. Many people use Sweda as such only, without Sneha. Even then, especially physiotherapists, they are not using Sneha. They are using Sweda only. Various modalities of Sweda they are using. But even then, some patients are getting good relief. But in patients where Snigdha is needed, Snigdha property is needed, then if you do Sweda alone, that will not help the patient. That may even complicate the matters. So, as a rule, when Amavastha is not there, Snigdha followed by Sneha followed by Sweda is to be used. Purification therapies like Nasya we have already enlisted. Is there any need to go to Rasayana therapies? Many of the patients who are not getting relief out of the ordinary medicines will get a relief out of Rasayana property. Even Gugriyutta Grida is Rasayana when we are using it as Rasayana. It all depends. Any drug is Rasayana. Even plain water is Rasayana. If you are using according to the Rasayana protocol, it is Rasayana. Prevention like doing exercises, continuous use of Sneha Sweda, etc. Ama can be considered in a local context like in cervical spondylosis and in a generalized concept. Pajana is the treatment which we have to give to when we are taking the digestive tract into consideration. Pain may be due to so many causes. Pain of ama is there, pain due to kapha is there, and pain due to avarna is there. All these types of pain differ. Pain of ama is severe. It is said that it resembles scorpion bite. That much severe pain. At the same time, pain due to kapha is a manda vedana. It will be a prolonged type of pain. At the same time, pain due to avarna by Medas is of a neurologic type of pain. Vadashonida, we have already gone through it. Lekhana, Pachana, Dhanyamla Sweda, Uddvartana. Uddvartana is a very good therapeutic tool which we can use in conditions of cervical spondylosis which mimics Vata Shonida. Even when Shonida element is less, only Kapha element is more, even then Uddvartana gave good results. Of Nasya and oil for the scalp we have already told. That is all. My topic is concluded, I think. I am thankful to the organizers for giving me a second chance. Not everybody are given a second chance. I am thankful to the organizers for giving me a second chance to enlist what I have not cleared in the first talk. I didn't get time. Sorry if my topic is delayed more than what is expected from me. Thank you all.
I'm sorry, I came in a little, there was an interruption, but I was like a bit intrigued by one slide of yours where you were talking about the Kshadoshma.
Kshadoshma.
Yeah. But I couldn't clearly understand how you were trying to interpret in the context of cervical spondylosis. Because a previous speaker said that Ayurvedically it is purely degenerative. But you were mentioning about Kshadoshma and then the stage of Vatarakta, which means then it will take an inflammatory course. So I was just wondering whether you were implying that because of Apikada can cause inflammatory changes after as a sequence. So what was it that you were actually trying to kind of convey here? I mean,
in Kaya we generally consider the stages whether it is ama or nirama. In the initial stage there is ama, and after a period of time it is nirama. Coming to the Sushruta school of thought where I am qualified, the initial stage rather than ama is a phase immediately following traumatology. Immediately after trauma, what would happen? Immediately after I fall down, what would happen? That hyperemia will be there, and many a time blood will be stagnated there, and severe pain will be there. Severe pain means excruciatingly severe pain. Excruciatingly severe pain is due to Vata. But at the same time, it should not be managed by hot procedures, warm procedures. It should be managed by cold procedures. Why? Because according to Sushruta, Rekta is also involved, or Rekta is always involved in the initial phase after a trauma. When recta is involved, you should manage it with Shira procedures, not warm procedures. So that is a concept of Sadhyavarana also. That is a concept of Sadhyavarana, and that is a concept of any traumatic lesion. Let it be related with even cervical spondylosis also, because cervical spondylosis in the long run is a chronic degenerative condition. But in a chronic degenerative condition, if an insult occurs, what happens? Suppose something happens in a patient with cervical spondylosis, he has got a whiplash injury. Whiplash injury we are generally connecting to an ordinary person. If whiplash injury or deceleration injury, any type of deceleration injury for that matter, when it occurs in a person who has already cervical spondylosis, what should be the initial phase of management? The initial phase of management should be according to Chadoshma. Muruganda should be applied there. But when it is chronic, what happens? Even in chronic conditions, pain will be there. At that condition, it should be managed by the principles of Vadatta or the principles of rheumatoid arthritis, for example. Recta is also involved there also. But at that time, Vada is more important than Recta.
Well, that is what I wanted to know, like whether the Vada Recta kind of situation will be also present in cervical spondylosis as per your opinion.
Vada along with Recta is to be managed differentially from Vada when the primary culprit is Vada. Recta only come as an ancillary support. Here Recta should be managed and there Vada should be managed. But Recta is there in both the pictures. I am talking about the Sushruta school of discipline, and it is very true also in general practice also. Suppose I am having myself, I am 52 years. Suppose I am falling down from this body and I have got severe pain. What should be done initially? Initially, it should be managed with things like Muruganda, which is Hira Sparsha. It is managed. We are managing Vada itself, but we are managing Vada through the management of Recta. I hope I can deliver what there is in my mind.
Okay.
Is there any other questions? Because all these are connected with concepts. I don't know how to explain much more rationally. When you are explaining a modern condition, it can be set aside. The modern condition can be projected very well. But when coming to Ayurveda, we have got several ramifications of Ayurvedic concepts. The Sushruta school, the Vagbhara school, Charaka school differs, and in some instances Vagbhara school is in tune with the Sushruta school, whereas in some other instances it is with tune with the Charaka school. So that ramification should be highlighted now.
Just one, I was just thinking that probably, I mean, I fully agree that in the initial cases, this is how we must approach it. But we do see that condition like cervical spondylosis doesn't develop into, something which is comparable with rheumatoid arthritis. That much of involvement of recta is not there. Is it probably, I mean, I'm just wondering, is it because in that area, the sthana is also peculiar. There is not much blood perfusion. The recta dhatu presence itself in that area is not so kind of.
If it is a chronic condition without any major involvement of recta, we can call it a Sandhigata. That is a usual pattern also. In 60% of the cases, it should be considered as a Sandhigata. That's what I have already told in my initial slides. But coming to a certain period, recta also will be involved. Along with Vada, if recta visheshana is there, we have to manage it at par with the principles of Vada recta. In Vada recta also, Vada will be more, recta will be minimum. So we should manage at par with Vada recta, not Sandhigata Vada. But again I am telling you, in the initial phases after an injury, it is not the Vada which is to be managed first of all. The recta is to be managed first of all. There comes the importance of Chadoshma. So four main principles are there for management. Briefing every management protocol in a tabletop. First one, Amavastha. Next one, Chadoshma. Amavastha with the perspective of Charaka or Vagbhara to a lesser extent. This Chadoshma with in the concept of Vagbhara along with Sushruta. that is set aside. And Sandhika, which occupies almost 60% of the management protocol of cervical spondylosis. And then Vadarekta, which also occupies somewhat like 15 to 20% of when recta is more, when the vascular elements are more prominent, we have to manage it on the lines of Vadarekta. I think this is the usual protocol which is to be followed. Then differences may be there according to the our school of thoughts and our school of studies. Differences of opinion also may be there. Please come. I cannot hear you properly.
Sir, you spoke something about geographical distribution of cervical spondylosis, sir. In certain areas that spondylosis will be more, in certain areas. Sir, you said in certain areas, like coastal areas where Utklesha and all is more, so there spondylitis may be seen more, something like that you just you mentioned.
I have translated the itis into amavastha and the aortic, spondylotic element into Vadaroga, that is Sandhigata Vada. Spondylitis means inflammation. There the inflammatory element will be more.
Sir, you mentioned
Geographical distribution means topographical distribution you are meaning. In Kerala are places which is near the seashore, places like Bombay, etc. That inflammatory element will be more. The degenerative changes will be elsewhere. It is there. Even in places which is away from the seashore, and even in places like Kerala, that degenerative changes are almost equal, I think. But in places where it is near the seashore, that inflammatory element will be more, because the place will be humid and moisture will be more, and there is more chance for moisture entrapment inside the tissues, not alone in the case of cervical spondylosis, but in any inflammatory condition of the body, even soft tissue inflammation of the body, that inflammations are more prone in that there is a geographical distribution, there is no doubt. I will come to what is...
Sorry, I'd just like to support what he was trying to say. I think the crux of the matter is the disease is basically degenerative, and it's common everywhere. I practice both in Kerala and Tamil Nadu. So I find there's a distinct difference in the way we can successfully treat. In Tamil Nadu, an area like this which is very dry, we can straight away go in for the anti-degenerative treatment without any fear of an amavastha developing. There is straight away start with the grida or a sneha. There is no harm that happens. Whereas you do the same intervention for a same condition in a place like Kerala, there is a tendency for some inflammatory aggravation. I think the disease is common to both, but because of the kalavastha, the intervention, we have to pay more attention to the ama while you are treating in a anuga desha than what you do in a jangala desha. I think the disease per se is the same. If I am right.
And that is what exactly I was trying to extrapolate. In Jangaladesha, the people of Jangaladesha will be more healthy comparatively, relatively healthy, and will have more life also. Lifespan also will be extended. Whereas in Anupadesha, the lifespan will be comparatively and relatively shortened. You all know where the more, I think it was in part of Russia that the lifespan is more, because it is near a Marubhumi Arogya Desha Nam. That mention is there in Sangraha also. Marubhumi Arogya Desha Nam. Whereas in Anupadesha, the lifespan is comparatively reduced due to so many diseases.